Hello, fellow Oregonians. It is I, the Naked Truth Babe, aka Layla, here to share some facts with you about what's going on here in the state and implore you to investigate this for yourself. I'm going to give my commentary on it and point out a few things that I'm seeing, but I encourage you to look at the data yourself directly and then reach out to your local authorities and find out what is being done in your area to open up small business, because what I'm about to show you may just change your mind versus what you might be seeing in the corporate media. I don't watch TV, my parents do. I'm here visiting them here in Troutdale, so I've seen what's being said there. But again, I don't do that. I go straight to the Oregon Health Authority and I look at the actual numbers of what's happening, and then I make my own mind up about what I think is safe and reasonable. So here we go. I'm going to show my screen. We're going to go to the Oregon Health Authority. I'm just going to show you what the numbers look like. So what's really nice is in the state of Oregon, we actually have some good numbers. There's a couple of statistics I would like to see that I don't see. So I'm just going to show you, but you can get to this. Just search Oregon Health Authority COVID-19. It'll take you to this page. And then you can go look at this stuff yourself. So what I'm seeing here is that in the state of Oregon, they've done 39,000 tests, and of that, about 1,900 people have tested positive. So it's about 5%, it's just under 5% of the tests coming back positive. So what's interesting about that is I wonder if people are getting tested that show symptoms of a viral infection of some kind or a respiratory infection of some kind, and that most of them are not, 95% of them are not this. So what does that say? That says that there are 95%, there are, 37,000 people showing symptoms, I would imagine, or they wouldn't be getting tested because that's what the directive is. And I don't know what percentage of this are people who don't have symptoms. I can't imagine that you would go get a test if you didn't. That said, 95% of the people getting tested are showing negative for this particular thing. Now, this doesn't tell you what kind of tests that they're doing, but my guess is that what the widespread testing that's been done is the PCR test. And you can look into PCR test and understand what that tests for. But what it tests for, from my understanding of studying virologists at Columbia University and others on This Week in Virology, is that it tests for parts of the particle, the viral particle. So it reacts with certain proteins and lipids that are in the particle itself. However, what it doesn't tell you is if that particular reaction is for an infectious particle or not. What does that mean? It means that you could show a positive test result for a non-infectious particle reaction. So there are infectious and non-infectious parts of virus that are around us all the time. And the tests that they're doing don't show you that. Now there's new tests that are showing antibody reactivity, two different antibody reactivities, IgG and IgE. And one will show you if you're in an infectious cycle, because there's certain things that your immune system will do when you're in the midst of an infection. And then there are certain markers that will be present if you've just completed that for that particular thing. So that test is great. Unfortunately, it's almost impossible to get. My brother's an MD and ordered these tests weeks ago, and they keep getting delayed, and he still doesn't have his hands on them. He's been told the end of the month. So I just feel like that there's a withholding of the tests that are going to tell us who's in an infectious cycle and who's already had this, which is very interesting. So this PCR test doesn't really give us the whole picture, and it can give false positives. This is the same type of test, PCR, that they do in like a Planned Parenthood or an office that tests for HIV. And then you can get the results right away. And I've had friends that have had a false positive test and then had to get a different type of test that confirms that, and it came back negative. So I don't know how many of these are false positives, but it's still a low number. It's still 5% of the people that are coming in saying, I need a test, I think I have this. 95% of them don't have it. It's interesting. So 74 people have died. That's terrible. This tracking, according to the numbers, it started on the 28th of February, I believe. I'll have to double check that, but let's just say it's almost 2 months worth of data, we have 74 people dying. Okay, well, who died? Exactly, and that's what I wanted to understand is the numbers that they don't show us is day by day what the deaths are. They're just showing tests and positive negatives if you dig into all these. So I'm just going to show you a little bit about this information. So you can see here in most of the rural counties, there's just very little. Baker County, there's 0. Coos County, 1 in Crook County. Deschutes County, 64 positives, 0 deaths. 0 deaths in most of the counties in the United States, in Oregon. And you're showing a lot more in Multnomah County. That makes sense because you have a lot more population density there. That makes a lot of sense. So what I can tell you from looking at this, from my personal point of view, is that that's a big number, only 8 deaths in Washington County. So, but that's a more populated density than some of the, like Deschutes or some of these other counties where they're showing 0 deaths. So we show 74 deaths for the entire state in a almost 2-month period, maybe longer. And then you can get into like the numbers by age group, which I find to be very interesting. So you can see that one person between the ages of 40 and 49 has died, 1, and 1 from age 50. And then all the rest of these are 60 plus. Okay, but what I don't have is the raw data, which I'd love to get my hands on the raw data, and I'm going to look for it and crunch my own numbers and show you what I would want to see, which would be every week, how many people were tested, how many were showed positive, and how many died each day, or each week at least. Then we could kind of see what's going on now. But people are like, 74 people have died, that's terrible. Well, how many people normally die from flu or other respiratory illness, flu-like respiratory illness in the state of Oregon in that period of time? Well, I can tell you nationally, our total mortality is down significantly. So what does that say? It says that overall deaths are way down. Well, that's probably because we're not doing anything. We're not driving cars, we're not doing anything. But there's not more deaths than there has been in past cold and flu seasons. There's actually less overall, which is, I find very interesting. So anyway, that's that part. And then you can also see that we have available tons of capacity. We have almost 800 ventilators not being used. And then when you look at this dashboard they've created, here's a look at the dashboard they created, which is a couple days behind as far as the data goes. You can see these are all the tests that were being done, and the positive people, they started, excuse me, these numbers go from January 27th. So you have 2.5 months of data, basically. So in 2.5 months, 74 people have died, okay? And these are all the people that have been tested. But you can see this, the way that they've displayed this is showing this very low curve because of this range. Now, if you were to take the range and make it only for the positive test, it's going to look a little different visually to you. That said, you know, you still have a declining, you have an upswing, and then you still have a declining thing going on. So you can see here that the data is not confirmed from the 8th on, which I think is ridiculous, but that's fine. They should have test results beyond that. That's over 10 days ago. That's crazy. But you can just see that the numbers are going down, which is really what we want to see. And the governor has said that she wants to see no deaths for like 2 weeks. But the problem is that the directive from the CDC to doctors, which I've read from the doctor friends, and you can research this, it's on the CDC website, says to go ahead and code for COVID, whether or not it's been confirmed or not. So the numbers have been inflated for anyone who's showing a flu-like illness or a respiratory illness to code them for COVID either way, whether there's a positive test or not. I don't know if in Oregon that they're following that 100%. However, that's the directive nationally and that doctors have been directed to do. How does that affect what we're seeing here? It's a good question. Here's another interesting table. Actually, this isn't the one I was looking for. Hold on. There's another table or a report that comes out, and it shows kind of all kinds of different statistics. What I find interesting is like they're showing all the symptoms. Okay, so 4% of people are on mechanical ventilation. Most of these things are benign type things that you could have from any cold or flu. Most of these things, no big deal. what I find interesting is that they asked for supporting risk factors, but the way they displayed this, I feel like could have been done better, and to prove that most of the people that are having risk factors is the majority of the people that are coming in and getting a positive test. So you can see that people who are in congregate living in tight quarters with lots of people, if they're a healthcare worker, if they have underlying conditions, if you were to add up the underlying conditions plus healthcare workers plus congregate living, you would have, 18 plus 17, that's 35%. You'd have 65% being in one of those three categories. But the way they've displayed this kind of makes it hard to come to that conclusion that most of the people that are coming in are from one of these situations. The other thing that I found really interesting was this. And this is not something you'll probably see on the news, of course. So, because it doesn't support the narrative that we should all be in wearing gloves and masks and afraid for our lives. This just shows in the state of Oregon, all of the long-term care facilities that show cases and deaths. This is the number that they're reporting here. Okay, so 32 of the 74 deaths have happened in long-term care facilities. Okay, well, what are the normal numbers for people dying from a benign infection in a long-term nursing facility? I would venture to say that the number is probably pretty much the same. Both three of my grandparents died in nursing homes, and my dad did, and they were all feeble and weak and on all kinds of medications and confined to hospital beds. Okay, so that's kind of what happens to you when you get old and you're in a long-term care facility. Usually what the final thing is that, the flu or some benign disease, your body just gets so weak and the immune system's function organs, everything else just can't support fighting off a benign infection, and that's what ultimately kills you. So this is normal. This is a normal thing. It's happened to several of my family members, like I mentioned. And so if you look at this number here, you can see that 32 of the 74 were in long-term care facilities. And this is from this last week. I want to say, what's the date on this one? This came out on the 14th, okay? So the other thing is that only 2 people under the age of, if we go back to this chart here, which is only 2 people under the age of 60 have died, okay? Only 2. Does this justify our whole entire state being on an indefinite quarantine, and that, dentists and massage therapists, and physical therapists, and people who are helping those of us try to stay healthy, gyms and all these kinds of parks where we would go to exercise and be out in nature, and all these things are closed. Over 74 deaths, 32 of which were in nursing facilities, and most of which are older people that most likely have underlying health conditions, which is what is shown here. It's shown that there is underlying health conditions in 35%. They're either healthcare workers or living in, prisons or group homes or long-term care facilities or shelters. Okay, so that's what they're showing here. So does this justify, the question is, does this justify the suffering of most people financially, which is causing emotional and mental strain, as well as just putting people in a worse spot? A lot of people living paycheck to paycheck. A lot of people who run small businesses don't have several months worth of reserves to pull from. They just don't. They don't make that much profit. So you have coffee shops, and you have massage therapists, and you have salon workers that do people's hair one at a time, by the way, one at a time, and they're not allowed to do their businesses. And in counties where there's just no evidence, in a lot of these rural counties, it's heinous to prevent these people from going out. You have entire counties with no cases or one. And then you see the curve going down. And the way they're displaying the data is a little bit misleading in my view, because if you were to look at it if I were to chart it, I would do the positive cases and the deaths on their own chart by day, but I don't have that raw data, or by week. I don't have that. It doesn't give it to me. I'm going to try to compile that by going through every weekly report if I can't find the data to download and put into a spreadsheet of my own. But the point is that everyone should be allowed to be out in parks. They should be allowed to run their small businesses with precaution, of course, like for anything. You know, if you're sick, don't go out spreading any kind of sickness to anyone. If you're not feeling well, stay home. I mean, that's common sense. And I feel like people in Oregon know how to do that, especially when you look at the rates. So my vote is for rural areas of Oregon to open up immediately. And there's a ton of data to back up the logistics of doing that. There's no reason to keep that closed. And then to look at Multnomah County, Washington County, and Clackamas County and figure out a way to get that fast-tracked as well. So there's just no justification to continue this in this state. It's very different from other places. Most of the state is very rural and people are spread out. So anyway, take a look at this stuff. I'd love to get your opinion on this, but my goal is to just open people's eyes to what they're not seeing on the news and look at the numbers yourself and then make your own determination. I'm all for independent thought. I'm not affiliated with any political party. This has nothing to do with that. It has to do with upholding the Constitution of the United States and of the state of Oregon and allowing people to be healthy. And this is preventing a lot of people from being healthy. I wanted to make one other point. When I go to the grocery store, I find that the workers are often telling me that it's very hard for them to breathe with the masks that they're required to wear. So we have places where there's pretty much no death and no cases, but the workers are being required to cover their face, and it's very hard to breathe in those masks, and they're having to go outside and catch their breath because it's so hard to breathe in those things. Is that make any kind of sense? And then also like the types of businesses that are allowed to be open, okay? So I can't have, if I'm an orthodontist, I can't take someone's braces off if they're due to have their braces off. I can't do anything. If I go to a chiropractor for adjustments, I can't do that right now. I can't go get a massage if I do that for my therapies. I can't do any of those things. I can't go to the gym to keep my health up, yet the liquor store is open. All fast food is open. So tell me how that is for our health and safety. I just don't agree that what they've defined as being essential. And I think for me, like all of the state parks are essential, all of supportive medical care. If you're doing a cosmetic surgery, that's probably not essential, but if you are needing to get your teeth cleaned or have dental work or get your braces adjusted, you broke something, you need your braces off, you need a massage, you need a chiropractor adjustment, you need, even getting your hair done, you're only seeing one person at a time. How is that a risk? Those people need to make a living. I want to be able to go to a coffee shop and sit down, even if it's outside. It just doesn't make any sense if you look at the numbers. So I just encourage you to look in your local area and please be vocal, not just to each other and your neighbors and stuff like that, but just get off the TV, go look at the numbers, and then go reach out to your local authorities. Talk to your city mayor, talk to the county officials. Do not stop calling and sending things to the governor of the state and all of the state legislators. And look into some more things about what's really going on here, because there's really no justification for this in the state of Oregon. There's been a lot of silence around these town hall meetings that citizens in their legal rights from the Constitution of Oregon are allowed to do. And also there's rallies to open up Oregon in several places. And I encourage you to support those people, even if you can't personally be there present. Let your voice be heard, and don't be afraid to just question it. Question everything. All right, that's my 2 cents. I hope that this was helpful for you and encouraged you to look at the numbers with your own eyes and make up your own mind. Naked Truth Babe here. I'll see you next time.